Hi there, everybody. Brilliant to see so many of you here to join us for what promises to be 70 minutes tackling, I think, one of the biggest challenges that Britain faces today, and that's the state of our public services. Let me give a little bit of context for our event and introduce the speakers, but I'll try to make sure we get more from them. But let me start by saying that I think the context for our conversation today is that our country faces a huge number of complicated, overlapping challenges. We have the challenge of an aging population, and that has lots of implications for different public services and how they work together. We have the challenge of climate emergency and all that brings. And then we have a context of stagnating or otherwise declining outcomes across agendas like health, education, crime, poverty, social cohesion. So lots of major challenges in our future. We also have major opportunities. The opportunities of technology and innovation intersect with those, but the question that raises is, do we have public services ready to take those opportunities? At the same time we have those challenges that we need to wrestle with, we also have something that IPR have called a legitimacy challenge. We have a context where trust in politicians and politics has been going down and has hit historic lows. And that's undermined the legitimacy of government to take action. Do people trust that government will have the solutions? And so we'll keep that separate challenge in mind as we talk about what some of the changes, what some of the paths forward might be. And so if I bring that together, one of the most challenging contexts that public services have ever faced, and we're going to discuss what the new Labour's government's priorities might be in facing against those. I'm delighted to be joined by a fantastic panel to help work through and muddle through some of those challenges with us. So first, let me introduce myself. I'm Chris Thomas, head of IPPR's Commission on Health and Prosperity and Principal Research Fellow at the Institute. On my left, I'm delighted to be joined by Georgia Gould MP. Georgia was elected MP for Queen's Park and Maida Vale in July 2024, was then appointed Parliamentary Secretary to the Cabinet Office shortly after the election. And prior to entering Parliament, Georgia, as many of you in the room will know, had been leader of Camden Council since 2017 and had done lots with the community there as well, including being a trustee of the Queen's Crescent Community Association, governor in William Ellis School, a great deal of experience. So delighted to be joined by Georgia today. Sticking with my left, I'm also delighted to be joined by Josh McAllister, MP, who won the newly created constituency for Whitehaven and Workington in the 2024 general election. Josh is a former teacher, the founder of Frontline, a graduate social worker training program, and he led that charity for 8 years, stepping down in 2021 to chair an independent review of children's social care for England. So again, a huge amount of experience and expertise to bring to this conversation. Going then to my right, I'm delighted to be joined by Councillor Nazia Rahman, who's Cabinet Member for Resources, Finance and Transformation at Wigan Council. Obviously, Wigan Council have been a long-time leader in public service reform thinking, and Nazia is representing the implementation of the Wigan Deal for the future, leading on transformation plans, public service reform, growth and customer service. So delighted to be joined by you today. And last but not least, on my right is Rich Lum, Senior Partner at Newton Europe. Rich leads Newton's public sector practice to improve how public services are delivered, thinking about some of those opportunities of innovation and technology that I mentioned earlier. And I should say we're delighted to be collaborating with Newton today on this event, and it couldn't happen without them, so a big thank you to them. So that's probably enough by way of introduction from me. What I'll do now is I'll turn to each of the panelists to give 5 minutes of introduction. We'll do a bit of conversation on stage, and then we'll turn over to you for some questions and answers. So do be thinking of some of your questions, and we'll come to those in just a short while. But Georgia, I wonder if I could start with you for some immediate reflections on the challenges we face and some of the thoughts you might have on how we can address them with the new Labour government.
Thanks so much, and really pleased to be here for this conversation. So, as you said, we made a junior minister in the Cabinet Office, and my brief is public service reform. So, I'm very pleased to be here for this conversation, and I can see lots of friends in the audience who've done a lot of thinking on this. So, I hope this is an open conversation, and as you said, they're such significant issues. It's something that we will need to work on together and bring ideas from every part of society, because as you said, I think things are in a really difficult place for our public services. And I was a councillor since 2010, and I've kind of seen firsthand some of the challenges we face. Firstly, with the cuts, where we've just seen a massive decrease in the capacity of all of our public services, but particularly around prevention. So some of the things that the last Labour government invested in, like Sure Start, that were preventing problems getting worse, were some of the first things to go. And that has just meant more and more crisis at the other end of the system. I think we've seen time and time again public services reorganised without any attention paid to those who are actually on the front line delivering those services. So the way that lands in communities is often goes completely against the purpose that central government was trying to put forward. So we've seen far too many kind of top-down reorganisations and inputs that don't actually deal with the significant challenges on the front line. And I think we've just seen enormous pressure on the system, and anyone who runs a public service or actually sadly now uses a public service will know that most of our public services are being held together by the kind of extraordinary dedication, love and care of the people who work in them, who are going the extra mile to fill in the cracks in the system. So it's a big job that we have to do. But I think the first thing and really critical thing this government has done is just set out how absolutely essential public services are to this country, and have a pride and a desire to speak up for public services and for the people who are delivering public services, and a recognition of how essential they are to the outcomes that we want, our missions, the opportunity missions, safer streets. Public services is a driving force behind that. But also for economic growth, we need people to be healthy and safe, to have a productive economy. So public services are essential there as well. So in terms of the challenge of how we reform and support them, I think for me, I'd like to just draw on some of the things I learned running public services in Camden over the last 7 years. I think the first thing is that if we're going to redesign public services, it has to be with and for those who use them. People who use public services have the best idea of what is going to kind of meet their needs. And when you have conversations, people often say they feel like the system cuts up little parts of them. So, they see them through the lens of whatever service that might be delivering employment, health, even domestic abuse. They're looking at the challenge that person has in that part of their life, rather than looking at how someone's whole life, their family, what's important to them. Because as we all know, no challenge that we face is in isolation to the other parts of our life. So we need public services that see a whole person, that can build a relationship with them, that can start with where they are and help take them on a journey. And to do that, we need to give people who are on the front line the time and space to actually build those relationships. And we need to have systems that empower people and help them to build stronger lives. And we can do that in really difficult circumstances. I know Josh, I'm sure, will talk about children's social care, because he's done some amazing work on this. But in Camden, we worked with parents who had their children taken away by the state, which is the kind of hardest edge of state power, because the council was concerned about the safety of those children. And we worked with them to look at how could we prevent that happening again. Which is a really hard thing to do, for those parents to come back into a place that for them caused huge harm, and look at how things can be done differently. And what came out of that work is their experience of feeling completely disempowered by the system. And even when we were trying to help, we would be having these multidisciplinary team conferences, so people don't have to tell their story lots of times, they've got lots of professionals in the room. But what parents said is they experienced that as lots of middle-class professionals telling them they were failing as a parent, and they didn't feel like they had agency in that system. And so we worked to introduce peer advocates and invested really heavily in family group conferences where you work really deeply with the network around an individual. You build up their capacity to have a conversation about how they can support a child, or we now do them, or Camden now do them with adults as well. And you look at the strengths within that network. And I think what's really powerful about those conversations is ideas emerge in the room that no individual could have come up with on their own. And so there is power and strength in communities and family networks that we often don't see unless we take the time to build those relationships and to support people in that way. So I think that has to be the starting point. In order to deliver that, we need to invest in technology, so those who are delivering frontline services are not being kind of stuck in bureaucracy, or indeed those who are receiving them filling out very long forms that are really complex, but have more time for those important relationships. And I think we have to move our investment so it's much more focused on early intervention and preventing problems escalating in the long term. At the moment, I think we've really skewed to having to invest only in that crisis point, and that is a false economy. It costs us more in the long term. And within that, thinking about how we spend money better together, because what you see when you're in local government is sometimes you end up you're spending a lot of time bidding for tiny pots, or in my own borough, we ended up investing in an entire employment service because we couldn't work as well as we should be able to with the job centre. And there is real cost in that. So there is money in the system that we could spend differently to invest in people if we had a completely new relationship between local government and central government, if we see the person at the heart of a decision-making and design services around them. And there's so I think that there's massive opportunities to reform our public services, always having in mind those who are using them, those who are delivering them, and keeping them at the heart of what we do.
Brilliant, thanks so much. Josh, I wonder if I could come to you next, and lots of experience of seeing this play out, but just for your opening reflections.
Yeah, thanks very much. Well, first of all, I started my journey out of the classroom to set up Frontline as I can't remember what they were called at the time, but as a research fellow at IPPR, working out of the old attic above the wine bar near Embankment. So really pleased to be here at this event, and IPPR is such an important organisation. And also delighted to follow Georgia because when I did the independent review of children's social care, which was asking the question, how do we better guarantee that children can grow up with the safety, stability and love that comes with a strong family life? And if they can't grow up in that context, how can we make sure that the care system provides the same foundations? Answers to that question were seen more often in the borough of Camden than any other local authority in the country. Now, some of that was structural because Camden has the benefit as a central London authority of good tax receipts, but it was also about culture and leadership, and the work that Georgia did and her team continue to do in Camden is absolutely extraordinary. It's got incredibly low rates of children in care. It's got a much higher proportion of money being spent on preventative early support for families. It's led the way on things like family group conferencing and all the sorts of things that Georgia mentioned that are about power sharing with families. And that is not an accident. That is a choice through leadership and culture. And so really delighted to be following Georgia in sharing a few reflections. So the first thing to say is that I think public services are currently caught, by and large, with some rare exceptions, in a very powerful doom loop vortex. And that is made up of a number of big features. There'll be other features that are part of it as well. But the main ones are that we are driven by short-term financial decisions when we're deciding how to allocate resources. And that means we're choosing as public servants and as policymakers to cut things that work, that are preventative, in order to save money over a 2 or 3 year time horizon that we know will drive up longer term costs found in late intervention and failure. We have a central government operation which operates in cognitive overload. It is simply trying to do too many things, and the public are expecting more of the state than ever, and that will only continue. We've got lots of willing public servants in the country that want to step up and claim that responsibility, but it is currently hoarded in Whitehall. And we also have, and this is maybe a more controversial point to make, a flawed belief that by piling more rules, more guidance, more direction onto frontline public servants, we will get a different outcome. And the argument I want to make is that actually by doing that, we remove accountability. We take away the keen light of accountability from frontline public servants who can operate with freedom and responsibility, and we take that away by adding layers and layers and layers of other people who've got a claim on that decision. And it makes it confusing, and it means that the public don't get clarity, they don't get speed, and they don't get flexibility in the provision of public services. So I think some of the solutions, and all of this really backs up the government's agenda on public service reform, and I know what Georgia is really passionate about, is first of all a shift to preventative spending. Now that needs to be through a Treasury-led financial mechanism that claws money out of late-stage crisis costs and prioritises investing them in evidence-based earlier intervention. And there is quite a lot of evidence-based early intervention that can be invested in. During the last government, I was involved in a number of spending review bids that the DfE were putting to Treasury, where they would find it easier to make the case for 100, 200, 300 million pounds for extra children's home capacity. We've gone in the UK, well, in England, from having 8,000 kids in the 2010s in children's homes to 16,000 children in children's homes. And we're an international outlier, and we're an outlier within the UK on that. Treasury were perfectly happy to sign off more money being spent on a capital project, because it was a capital project, not a revenue cost, on the thing which is the very definition of a late-stage crisis cost, than they were prepared to spend the 200 or 300 million on, for example, family group conferencing, that well-evidenced intervention that will keep families together. So something fundamental needs to change in the Treasury mindset that means government departments have a willing recipient to bids that are genuinely about doing that shift. The second one is about powering up the public in the provision of public services. And a really great example of that is family group conferencing, which Georgia mentioned. When Labour was last in power, the big agenda was around contestability and competition within public services. I think now there's a really good argument to say we want to create space in the provision of public services for flexibility led from facilitation of families and recipients of public services coming up with their own solutions. It's not that mad a suggestion, but families often have a much better answer to the problems they face than a whole plethora of public servants. And they've got much more skin in the game. They've got to live with the consequences of these decisions. So whether it's in youth justice, whether it's in the criminal justice system and probation, whether it's in children's services or the health care settings, there is a really strong case for creating a bit more risk, a bit more flexibility for the public to step forward and say, we've got a better solution than public servants in this case. And actually the public services job is to facilitate that solution and make it work, not to give the one-size-fits-all answer. The third one is about unleashing the talent of public servants. This is both a productivity challenge, because we are spending more money on our public services, and this is the awkward, I guess, inconvenient reality. And we're on track to spend even more as a proportion of GDP on public services in the decades to come. And outcomes are getting worse, and productivity isn't shifting. So the answer of just pouring more money into public services and expecting different outcomes won't work. And a really good example, again from Children's Services, of this is that we have 30,000 social workers, people that, by and large, overwhelmingly come to work to do a really special thing to support families and vulnerable children. Of those 30,000 social workers, 10,000 of them don't do any frontline work with families. And of those that do, 80% of their time is not spent with children and families. So we've built a system with more layers, more checks, more people checking the people and watching the people doing the work. And that means that those who are on the very front line of these services do not have the time to build the relationships and do the work that their evidence-based tools or their interventions will actually deliver results in. So we end up with more expensive, burned out services that the public have less confidence in. So something fundamental needs to give, and there's a big programme of reform there where we could free up public servants, get them much more focused on the thing they came to do, improve outcomes, but that requires people in the centre of government and politicians and policymakers, both in local government and in Whitehall, to be comfortable letting go a little bit and saying, you know, we're going to put the accountability on the front line, and with that comes the freedom as well. So we've got lots more to share, but there, I guess, three bigger thoughts about what needs to happen to create a plan, a reform programme that cuts across public services, that powers up the public, that really goes big on devolution, not really talked about that, but maybe we'll come back to it, that rewires how we do funding of public service reform so it incentivises proper prevention, and then also unleashes the hundreds of thousands of public servants who are being held back by a system with an outdated mindset.
Fantastic. Thanks so much, Josh. And I think that's really tangible. So I'm sure that will give lots of people thoughts about things they might want to follow up on in questions. But Nazia, let me introduce you and bring you into the conversation. What are your opening thoughts? And obviously Wigan has been for a long time at the front of public service reform thinking and how to do it, but you'll have lots of experience in how this actually works.
Yes, we do. I'm very delighted to be part of this debate today, and I'm really honoured to share this platform with people like Georgia and Josh, who've been heavily and deeply involved in how we transform the public services. Well, today I can say that there is no denying that public services are at the brink of collapse. They are underfunded, the system is obsolete, and they are not fit for purpose anymore. The society is changing every day. The way we live our life has changed. The lifestyles are changing. The demographics are changing every day. Digital and technological advances have completely changed the way that we look and we used to interact with our surroundings and the wider world. The climate crisis has come to the forefront, and the environmental threats are becoming more and more real with every day. So, to make it worse, the unregulated social media, the misinformation, the rumors, the propaganda, divisive propaganda, has further eroded the trust and the confidence that people used to have in politics and politicians, and that makes our job very, very hard. So, what do we do now? How do we transform the public service? How do we regain and rebuild the trust in politics and politicians? How do we deliver on people's genuine concerns for a better and a prosperous society? There is, I think, everyone would agree that we need change in public service. We need to address health and wealth inequalities. We need to build resilient communities, safer streets, and we need to come up with policies that make as much human sense as financial and economic, because we can't deliver one without the other. IPPR has just concluded a cross-party 3-year inquiry, and one of the most meaningful conclusions that struck me was the better health is the most important medicine our economy needs for the faster growth that this government has said that is part of their 5 priorities. So it's the better health. It is the better mental and physical health that will change us as a society. It's not injection of more money. It's not top-down systems. It's not telling people what to do. It's asking people what to do, what makes them happy. It's trusting the people to actually come up with the solutions of the problems they have, rather than looking at people as problems. So it includes the inquiry concludes that things need to change, the systems need to change. If we stick with more of the same, more doctors, more hospitals, the end result will be more disease and bankruptcy, and we cannot afford either of those. But on a positive note, I don't think we have to reinvent the wheel. Rather, we can build on the great work, the great values that we see across our public sector, across the private sector. And as a cabinet member for Finance, Resources and Transformation, I've seen firsthand the great work that the local authorities are doing. I think Georgia is a great advocate of how those bottom-up approaches can change people's lives for better. We, in local government, we champion the bottom-up approaches, which can help to achieve the best outcomes, not only financially, but achieving better health, wealth, resilient communities and safer streets. So we know the solutions to our problems, and they lie not in Whitehall, they lie not in more funding, they lie in our communities, in our voluntary sector, in our faith sector, and in the people that we all serve. I am really, really proud of the transformational work that Chris mentioned, which has taken place in the last decade since the austerity began in Wigan. As an ex-mining, ex-industrial town with very, very low growth, poor connectivity, with low employment rates, we, at that point, tried to and decided to change our relationship with our people, with our communities, with our businesses, and with our anchor institutions, with our partners that we served. So we actually transformed the way we deliver our services, and we changed our relationship with our communities. We knew that the answer to health crisis does not lie in the four walls of our hospitals. It lies in the communities. It lies in the voluntary groups that we have in our communities. We just had to exploit those relationships. We utilized our community, voluntary and faith sector to bring people together, to harness friendships, to enrich our lives, to give people hope, to defeat loneliness, to improve health and well-being. And we have successfully made our communities in Wigan more stronger, more connected, more resilient, and ultimately happier, because we know that the solution of the problem lies in the brain, in the mind and mental health, rather than in our infrastructure, in our streets, and in the capital projects that Josh mentioned. So we are still working very, very closely with our businesses, with our GP practices, our schools, university campuses, police, and our voluntary sector as equal partners. So we don't see them as out of the systems. We see them as our equal partners because, to be honest, government, central government or local government, we are not the fixers of all the problems. We can facilitate, we can enable, we can empower our communities to find the solution to their problems. So we are taking a step back and inviting all our partners to devise solutions for the problems that we face as a place. So I think the key lesson that the government can take from our experience in Wigan and in other places like Camden is how informal relationships can facilitate delivery of formal and sometimes statutory services, as well as making financial, political, and economic sense. How we have created community wealth and have used every lever of power that we had, from our procurement to commissioning, from our recruitment, land and assets, to increase opportunities for local people. So we have used every power which was in our discretion to actually use that to deliver for our people directly or indirectly. And I would say that if we are really serious about transforming the public services, we'll have to go back to the neighborhood models. We'll have to go back to the deeper community engagement, co-production, and investment in our workforce. We'll have to focus on the prevention first, rather than intervention when it hits the crisis point. I believe places like Wigan, Camden, and many other local authorities, our experience in local government is a really good example for the central government if they really want to shift, and when they are trying to shift the system based on managing nation's health crisis to one which focuses on proactive and ambitious health creation. So we shouldn't focus on how we fix the problems, how we treat diseases when they reach a crisis point. We should actually invest and focus on health creation from a very early age with early intervention and prevention. Thank you.
Fantastic, thank you so much. And if anyone hasn't seen the work that Wigan has been doing in that austerity context, I strongly recommend checking it out. It really is very powerful. Richard, let me come to you for your opening remarks, and obviously you'll have a lot of experience in this link between policy and delivery, which is really interesting. But what are your opening thoughts?
Yeah, thank you, Chris. Thank you to the fellow panellists, and thank you everyone for coming on a rainy afternoon. So the question that was set out is, how will Labour fix our public service? And as the other panel members have alluded to, in a way, Labour have already set out a plan for this, and that is through missions-led government. And when we look at the missions, that in itself sets a direction for the improvement. But when we consider how complicated and difficult the missions were already going to be to deliver, that's now been compounded by the £22 billion black hole. And so perhaps the exam question is better framed as, how will Labour deliver on its missions and save money at the same time? So I'm going to try and do my best to build on what the other panellists have said. I want to reflect a bit on the nature of the problem, share some experiences around how we deliver this sort of work across the public sector, and then maybe offer up some lessons for the missions to consider in the detail of its implementation approach. So on what needs fixing, and this goes to Josh's point on the doom loop, we need to be careful here not to focus on just closing that £22 billion black hole. I think at best that will stabilise spend on services that are already failing, but at worst it will see short-term cuts to services that only fuels future demand. So the focus really has to be about improving lives and reversing the gradual and extended decline in our public services' ability to meet the rising demands of residents. In our work at Newton, we partner with organisations across the public sector, and we've really seen the first-hand impact of this decline. So George and Josh talked about the impact on children's services. Our studies show that for a third of children who end up in care, with different interventions prior to that point, that care could have been avoided. Or when Nazia talked about the importance of health, when we look at older adults who are in hospital beds receiving treatment, 35% of the time that they spend in that hospital bed is waiting for something to happen. And when you look at those people who then go on to enter residential care as a setting, for 20% of those people, that wasn't the ideal outcome for them. And with different services and interventions up front, that could have been avoided. Now, why do I think that's important? Well, it goes to the point that other panellists have raised around prevention and around the organisation of public services. So the fix will be judged, yes, by saving the 22 billion, but I think more importantly, it's going to be addressed by improving the lives and the outcomes of people who go through services. So what about the fix? As others have alluded to, it's going to require inversion of the model of delivery of care, much more focus at the front line, much more focus on prevention, and how we interact with public service differently. And I think the choice of missions-led government, in a way, shows a recognition of the true nature of these problems. So the missions show that we understand the problems to be systemic. It recognises that the issues are cross-cutting, and it shows that the root causes have been enduring. But what the missions now need to set out is a more granular approach and methodology to how it is going to both improve outcomes and reduce cost. So some thoughts on this. Newton, as I say, have partnered with leaders and organisations across public sector for the last 20 years and have a track record now of how you can reduce cost and improve outcomes. And from this, I think there's three learnings for us to focus on. One is around how the missions use data. The next is on how they target services. And the third is how they coordinate services with service users to build a model of care that's right for them bottom up. Now, we could talk about each one of those. We could have a panel for an hour on each one of those individually, right? So instead of that, what I want to try and do is just paint a picture through one example of our live work, which I think brings some flavour to this. So if you're over 65 in the UK, you have a 1 in 3 chance of falling over each year. And that in itself can be quite distressing. It can knock your confidence. But it also has a significant cost to the UK economy. So it's reported that falls cost the NHS alone £2.3 billion a year. But when you look at the amount of money that local authorities spend on residential care, that is up at £20 billion each year. And 40% of those admissions are as a result of someone falling over. So there's a significant financial opportunity here. But But it's a knotty problem because it's not on the NHS or on local authorities alone to fix the problem. It is an issue in how we deliver our public services. So through work that Newton have been doing at a local authority level, we can now identify with 70% accuracy people who are going to fall in the community. And through redesigning the services in the way that's been described, bottom up, involving users, changing financial incentives and targets, looking at the structures and models of care that are deployed, we can prevent up to a third of these serious falls. And that starts by better leveraging data, connecting data across the public sector, applying advanced analytics AI to identify individuals who are at risk of falling. With that knowledge, we can then better target services. We can move away from universal services to more targeted interventions that work with the individuals who need it most. And then through rewiring public service, changing the financial incentives, changing the models of coordination across layers of local government, health, fire services, volunteer organisations, the individuals themselves, we can better design services to support those individuals, which results in the prevention. And while that's only one use case, we can see similar examples that apply across reducing violent crime, identifying children at the edge of care, looking at people who are about to become homeless, or identifying people who could better draw down on benefits and support to maintain their independence. And the consistent theme to all of that being a shift towards a preventive intervention not only delivers better outcomes for individuals, but is of lower cost to the state than simply dealing with the consequences. So just some thoughts on missions and sort of the challenges that lay ahead. I guess firstly, you could in a way create a mission in itself around how government uses data. It's a well talked about topic and a big one. And trust, as was mentioned in the introduction, comes into this a big way. But we really have to face into how we share data across public sector and how we use that as a force for good. And some of that is going to be changing a narrative with the general public around the role of government as a data processor and the ethics and considerations in how government uses data to better tailor services for individuals. Next, and in tailoring services and targeting services, that's going to require a choice. So if we're going to move away from more universal services towards more targeted services, there's a narrative there that needs to be shaped up with the public around what impact that might have. And lastly, however government is structured, there will be silos, but a model of government has to be put forward that enables the front line to be better empowered, better coordinated, better include the service users to shape and design services that will be of most impact for them. So just to close, how will Labour fix our public service? How will it improve outcomes while reducing cost? I think the answer in a way is missions, yes. Missions, yes, but it's in the detail of the approach and how we rewire services to be bottom up that will objectively improve outcomes and save money.
Thanks very much. Brilliant. Thank you so much, Richard. That's a really tangible set of examples, and that example of falls prevention is really, really powerful, so thank you for sharing it. With an eye on the clock, I'm going to go straight to questions from the audience, and yes, as expected, lots of hands. So I think my lovely colleague Keir is going to come around with a microphone. And let me start just at the back so I don't forget people at the back. I think there were two questions there, someone standing, then someone sat. I'll take a round of questions and then we'll go down the panel.
Hello, thank you. My question is targeted to the last speaker. I think it was quite clear when you were talking about your 3 areas of improvement regarding data usage, targeted services and coordinated services. It was quite clear on your first 2 about using data and AI to identify risks to help with prevention, and also for targeting services, again, and there's sort of a narrative that's needed to move away from universalism. But can you I would ask you to just elaborate a bit more on the coordination point. It seems to be, I think you were a little vaguer on terms of how you can better design services to coordinate services across government, and how that is going to drive better outcomes at lower cost.
Fantastic, thank you. So a question on how we coordinate. I'll take a couple and then we'll go down. I think there was a question from a lady at the back.
Thanks. Amanda McIntyre from the For Baby's Sake Trust. How do we make sure, and we work with families to break the cycle of domestic abuse and give babies the best start in life when the parents didn't have that themselves. So my question is, how do we make sure that the prevention agenda creates the room and the funding available for the investment where the requirement is intergenerational? For the families we work with, it's certainly prevention for that unborn baby we start in pregnancy, but the parents, probably the grandparents, probably the great-grandparents, all needed the support. So therefore the solution is deep, trauma-informed, attachment-focused work. It's not a wee light touch on the tiller before something's happened, because an awful lot has happened to reach the point where this family want and need deep support to break those cycles.
Brilliant, thank you very much. Questionnaire on intergenerational prevention. Make sure I represent the left side of the room. Gentleman, I think, had a hand up there. Yep.
I'm Neil Nerva, Councillor in Brent and Vice Chair of the LGIU. I just wondered to all of you how I was very taken by the comment about silo working, and we know the impact of silo working. How can we reduce the incentives for organisations to default to silo working? Not because they believe in it, but because of short-term financial expectations. And how do we get very senior bodies across the public sector, not just government, but NHSE, to work in a more collaborative and enabling way? Thank you.
Fantastic. Let's start with those three, and then we'll have several more rounds, don't worry. Going down the other way, Richard, I wonder if I could come to you first. And there was a question addressed to your initial remarks, but feel free to go through all three.
Yeah, of course. And in a way, I think the first question and the last question are related, right? So I think you're right to call out the last one, and probably the one I was most vague on. I think it's also probably the most complicated one, right? Because the data sharing and analytics, the technology is there, there's some decisions to be made and choices to be made, but I think the use cases are proven now that you can connect data up and generate better insight. Similarly, the policy choices about prevention, I think, are easily said but harder implemented. In coordinating services, that is the trickiest area and the trickiest one to get the behavioural, cultural process and incentive changes right. So I mentioned we do a lot of work with local authorities. I think we've worked with about a third in the country, and a lot of work on urgent and emergency care. And it's not uncommon for us to find that we'll get together community workers from both health and local authority, and they'll sit in the room discussing the same person, but for the first time. And they'll have two sets of case notes that refer to the same individual with slightly different language, two sets of understanding around it. And that is not the way the system's designed. No one wants to work that way. No one wants to turn up to work and find that duplication is happening, let alone the impact for the individual. So why does it happen, and how do we unpick it? Well, I think at the moment, I'd say at a local level, you have to fight the system in order to make that the case. Like the silos are such that that's how the organisations are laid out, and I haven't even included voluntary and community services in there. And so there's somewhere in the flavour of how does the funding work? Like naturally at the moment, there's competing incentives across health and care teams or voluntary organisations as to who should work with this individual, how does funding get protected? There's behavioural things, like some people will turn up to work with a certain badge on, which that's the view of how they see the organisation. And some of that is in just the leadership and the leadership at a place level to organise and coordinate services in a different way. And so I think that, to my last point, is the real challenge for the model of government that's proposed. How do we incentivise and create different models at a local level to have those conversations in a more meaningful way, as opposed to, as some of the other panel members have talked about, that being sort of the domain of central government to dictate to local government. And I think that's going to be the big challenge in moving the missions forward.
Brilliant, thanks, Richard. Nazia, what do you think?
So I would like to address the question about domestic abuse and how do we change the system around that. I think the first step that we have to take is education. So we have to teach our children in schools, in primary schools and high schools, that how serious this issue is. So I think we have to start with a new generation to tell them that, the repercussions and, what domestic abuse is. I also think that the legislation around domestic abuse and how it is criminalized or not criminalized has to change, and we have to have some serious conversation around the legislation. There is also a break when it comes to police and the criminal justice system with special regards to domestic abuse. The system is broken. People do report domestic abuse. It doesn't get to the right channels. When it comes to criminal justice system, most of the complaints fall through. So we have to change, and we have to have a robust system if we are really serious in addressing the domestic abuse. And can I just answer the silos question? In Wigan, we had, like every other public organisation, we used to have this silo working. People didn't know what they were dealing with. They only knew their departmental work and, their job descriptions. So we had to bring a culture change from the top. So you have to have that culture that brings people together, that welcomes challenge, and that actually gives permission to innovate and challenge the old ways of working. So it starts with the culture change, and I think once the culture change is embedded in organizations, we can break those silos and we can work collaboratively.
Brilliant, thank you so much. Georgia, if I come to you, and I think in those questions you've probably got 3 or 4 of the biggest challenges that with your brief you'll be wrestling with. We've heard incentives, silos, intergenerational deals in terms of prevention, but what did you make of it?
Yeah, I think starting, Amanda, with your point, which I think is really powerfully made, that so many of these challenges are intergenerational. And when I was leader of Camden, we did some work with young people who had been involved in the youth justice system, and we kind of traced back their cases, and in every single instance there was a kind of background which involved violence and neglect. And not that it's inevitable that if that happens that's the route you take, but I think it just shows that there are a lot of young people who are just not getting the right support as they grow up because of the trauma they've been through as a child. And I think that Sure Start and early years support, the first 1,001 days, there's a huge amount of evidence of the importance of interventions at that stage. But we do have to follow that through, and I think real attention needs to be paid as a child grows up, and particularly at those transition points, transition to secondary school and transition, out of 18 services, which often can feel a bit like a cliff edge for young people where support ends and those transitions aren't as strong as they should be. So we need to put that support in for that journey, but also for parents at the same time. And that's the point about looking at people not in isolation, and it links to the other point, but looking at people within families and supporting people within families, and what are the kind of strengths and what are the needs of that family. And I think the question about how you actually get the system to work together, I think you need to start with the person. And the work they did in Manchester was they started to look at the individuals who were being seen the most by different parts of the public sector, and it was often the same people who were using A&E a lot, who the police were going to see, who were drawing on council services, but as was said, that there wasn't a one conversation going on about how to support those people. And sometimes they were dealing with up to 15 professionals. So it's if you start with them and how you support those individuals and develop services around that person, then you start to see the system will come together. And you were saying earlier, we didn't talk as much about place, and I think place is so important, because it's at place that you can start to knit together housing and social services and the NHS. And people want to work in this way. It's the system that's pulling them apart. So I think that it links hand in hand with the devolution agenda. And our role in the centre is actually to free things up at place, so people can work together in that way, can build relationships, can build teams around individuals, and the funding incentives and the different structures don't get in the way of that.
Yeah.
And Josh, over to you.
Yeah, so, For Baby's Sake does some fantastic work. The role I did immediately before becoming a Member of Parliament was as the Executive Chair of Foundations, which is the What Works Centre for Children and Families, and fund and support some of the really promising evidence-based work that For Baby's Sake does. On the intergenerational intervention question, 2 points of example on this, which I think illustrate what we should do and what we should do with care. One is that it is frontline professionals themselves that see where these cycles go uninterrupted. They've got the expertise and knowledge to see it. The centre can't see it. And this really goes back to my point about trusting frontline practitioners with the power to design services that respond to need. Because, we could list off 10 examples of intergenerational missed opportunities of intervention, but there's probably dozens more. And a really great example of this is Sophie Humphreys, who is the founder and chief executive of an amazing organisation called Pause. She was a social worker in Hackney. She ran the child protection service there and saw that there were young mums in particular who had children removed and taken into care. There was loads of intervention, loads of support for those parents, right up until the court made the decision to remove the child. And then there was nothing, absolutely nothing. And for anyone in that position who yearns for love and purpose and a sense of building something and having something of your own, and being susceptible to abusive relationships and addiction, in that context, you are absolutely going to go back into the same loop again. So Sophie Humphreys and an amazing family judge who sadly passed away a couple of years ago, Nick Crichton, built both PAWS and the Family Drug and Alcohol Courts. And they had to battle 4 years against broken hierarchical public services to build and create these very special interventions. And even to this day, both FDAC and PAWS are being smothered, not enabled by our state. And I think that's really telling. We've got frontline public service entrepreneurs and public service leaders trying to do this stuff, and we have to shower them with praise. We need to put a heat shield around them, give them all the resources they need, and wish them well. And really, that is probably one of the best bets we can have. The example I would use for where we should be careful on the intergenerational question is about care leavers. So from good intention, statutory guidance basically says that when a care leaver has a child, local authority services should go and assess them. Now, the experience for most care leavers of that process is really oppressive. You know, these are young people who have often been really let down growing up by a council who then come knocking when they get pregnant. And I just think we need to think really carefully about what it means to intervene and how that's experienced. And then just, if I may, on this question about collaboration. So one thing to hold on to is why we have silos in the first place. And a really good justification for silos is expertise. And we want expertise, we want people to build their expertise and intervene effectively. How you mesh expertise across different services together so that it's effective is really challenging. And I don't think there are that many examples of us really nailing that, so that you get different disciplines within one team with a shared purpose, but that very distinct expertise. One example where you did have it was in Sure Start centres. And again, this answers your question, which is that if we were to rebuild the 3,500 Sure Start centres today, it would cost us about £2.5 billion. Now, a third of that entire cost would be met by the 15,000 reduced childhood hospitalisations. A third of the whole cost of it would be met just by that outcome. And there are other outcomes. We now know the IFS is doing waves of studies on this. The next one that's due to come out very soon is on children in care, and I imagine there will be some savings there as well. Basically, it tallies up to at least £2.5 billion, if not more. And one thing we could do is essentially say to those local authorities, those services in a place, as Georgia was saying, you can only spend this ring-fenced sum of money on this shared set of outcomes using these evidence-based interventions. You choose how to do it, and if you don't all agree, you don't get the money. And you know, that would basically force, within a short space of time, with very little additional money, the rebuilding of the entire Sure Start programme. There will be, if we did that, there would be, I mean, Georgia would have 38 chief police officers on the phone very unhappy. You'd have every ICB in the country screaming down the phone. Local authorities probably be the only partner that's delighted with it. So it would cause a proper ruckus, but we need to cause quite a few ruckuses to get this set of public services back in the right direction.
Brilliant. Thanks so much. Really interesting. Lots of hands shooting up. There you go, lady at the front. There's a microphone just coming.
Right, my name's Maureen Cleater. I'm a councillor at Maidstone Borough Council, but I come from this with like 3 hats. 1, as a union rep who had to negotiate on stuff. 2, as a frontline support worker in mental health. And 3, having to work in a Conservative county council. We've had PricewaterhouseCoopers in 3 times. We've had Newton Europe in, and every single time the services got worse. Nobody is listening, and this is where it was really wonderful to hear you speak, Georgia. You need to listen to the people who use the services, but you also need to listen to your frontline staff. And it is not only social workers who are getting chained to desks inputting data, it's us as well. I spent more time doing admin than I did doing seeing people. And I'm really pleased about freeing up professionals to actually go and do what's needed, because that's what needs to happen. We would say, can we run a group? Because we get people who drop in and go, I've had this letter from the DWP, what does it mean? No, they've got to be referred, have an assessment. And I'm like, if we had a drop in with tea, coffee, we could nip all this in the bud. But we were getting people so they were deteriorating too much. They were either being arrested, going under mental health services. To me, and this is what I would welcome your opinion, the biggest objection I see to joint working is who holds the budget. Because if I had £1 for every time I was arguing as a frontline worker on budget, you could fund the services probably. So my question is, how do we get rid of all of that stuff and have the good stuff that we all do?
Thank you. We'll go to second row here.
Thank you. My name is Councillor Lutfer Rahman. I also work at the local authority. I'm a family hub manager. Also, I'm a family conference coordinator. Qualified. So everything you just said, Georgia, I meet that criteria. My concern is, yes, Conservative government have taken away the Sure Start, but they rebranded it slowly, you know, and now it's called Family Hub and Children and Family Centre. So I manage one quarter of Tower Hamlets, which is one family hub and 2 children and family centres. We are really struggling to share data. It's really important that all the services work together. I understand, Josh, what you said earlier, that we need to be able to share it, but DSC don't allow us to do that because everyone have their own data system. And much as we built a forum, and that was my job to do that, is bring all the voluntary sector, public sector, private sector together, and we do hold a forum, and we meet two monthly. The concern is here, we cannot share data. Yeah. And how do we go around that? It's very difficult. Another thing you mentioned earlier, sorry, I forgot.
just have to push you on a question so we can get other people.
Another question is about taking away the universal services. We have in Tower Hamlets very vulnerable families, and some of them do come to our universal services, and then we pick up the needs, and then we put them into target groups. How do we then identify those families if the universal services are completely taken away? We need those services as well as targeted services because they are just as important. Yeah. And I'd like you to kind of explore that a little bit more. Thank you.
Brilliant, thank you. And then just behind you in the third row.
Thank you. Yes, I'm Devon, the Director of Policy and Practice, and lots of work with Georgia at Camden on tackling poverty using data. So 2 main challenges I see from doing this work, both in tackling poverty and in social care. The first one is a huge level of risk aversion in government to moving on this. So I guess the question there would be, is it as simple as having great MPs who can vote on this stuff, push it through, or is it actually, it feels like it's not as simple as that from my experience. And then the second question would be also kind of much more from a frontline perspective. There are certain behaviours here, while we may want to share data on the front line, actually a lot of frontline workers are very, very uncomfortable about that. So there's kind of a level of culture change required. And I guess the question is, while we all want to go in that direction, how do we do it at the pace at which we need to go? Because that is going to be, I think, one of the hardest challenges.
Fantastic. Really pertinent questions. Thank you. Maybe, Josh, I could start with you and we'll go down the road the other way, but immediate thoughts?
I'll be quicker in my answers this time as well. On data, I mean, a really good example of this is that we had the death of Star Hobson. When that happened, I remember the debate in the House of Commons. Loads of MPs stood up and decried the appalling situation and circumstances around it. And it was whilst I was doing my review looking at the whole of the care system. And there is always a worry about these quite very rare instances of high-profile child deaths creating moral panic in systems. But what it does do is it does focus people's attention, and they end up having to dig around and understand more in a service that they're unfamiliar with, what it is that's going on. And in that high-profile case, as with almost every other high-profile case of a child death, one of the findings was services weren't sharing information together. There wasn't enough of that. Now, there are agreements in place that mean that in a safeguarding partnership across services in an area between local authorities, health and police, there should be in place an information sharing agreement. Not every part of the country at the moment has an information sharing agreement in place. When I pushed the Department for Education to provide an example of what a good information sharing agreement should be, they didn't want to publish one because they were too worried about the challenge that would come to their exemplar of an information sharing agreement. And I think it speaks to this point around risk aversion in central government, that if you've not got a confident enabling state saying our role isn't to do all of this stuff, it's to gather the evidence, share the expertise, create the framework and regulate and publish data, that should be the kind of core function of the central state in the UK, I think. That creates the framework in which local services can get on and deliver and operate effectively. But there is such a deep aversion to stepping into that space and owning it with confidence within government departments that it just needs to happen. You know, and there are loads of examples of that. It can be done. When I was doing the review, there was a brilliant group of practitioners in Bristol City Council, 2 guys who went on to work at Social Finance, who'd basically built this model of information sharing agreements so that practitioners could see the live information about families. Was the kid in school that morning? They didn't need to ring round all these different services. It was there. It had been done. The Department for Education had a team of 15 people doing data transformation. They had no idea what they were doing, if I'm being honest. They didn't. These 2 people in Bristol did, and the money should have all gone to them, and they should have spread that model around the country. So it's a great example of both the risk aversion in central government and how, you know, we can use those who are in the services at the moment who've got the answers to spread this stuff around.
Brilliant, thanks so much. Georgia, if I can come to you next.
Yeah, I think to your question about what enables it to happen, I think pooling budgets is definitely one driver of change. The Manchester example I mentioned, I think that partly has been so successful because the council and the health trust had a pooled budget, so you don't get that issue that Josh talked about earlier, where you're cutting something which you know is saving money, but it's saving money somewhere else in the system. But you can do that through aligning budgets as well. I think there's examples where co-locating services has made a massive difference. Data sharing, where it has worked, also I think there's examples where that has made a huge difference. Even just aligning geographies, I think can change things. But I do think there are some areas where the level of central control has just stopped certain services being able to work together with other areas. So Liz Kendall recently set out her vision for transforming employment support, which I think is a really exciting opportunity, because I mentioned earlier, it can be hard to bring the kind of resource that is in DWP into the kind of community work that we're doing. So family hubs, which sadly are not everywhere in the country at the moment, but family hubs, where you can integrate health visitors, where you could integrate employment support, that strengthens the wraparound support that families are getting, and being able to support the system to enable that, I think, makes a huge difference. On the broader point about data, I think that one of the kind of exciting changes that has happened since Labour come to power is the move to DSIT, bringing together government digital services with a real aim of transforming and supporting public services. And I think that the potential of digital is, if you're thinking across central and local government, is enormous. Both in and of itself, but if it's designed around people and frontline practitioners, to actually stop all that time you're spending on filling in forms, because some of that is automated for you and you have more time for the face-to-face work that makes a difference.
Brilliant, thanks so much. Nazia, if I keep going down the line.
Yes, Maureen, I totally agree with you that the system is disjointed and no one knows what's happening. No one is there to take responsibility and accountability for what's happening. So I do believe that we have to realign and we have to rethink and we have to put public and person back into public services. Yes, because they are the ultimate recipient of everything that we do. It is public money and we have to be accountable for the whole system should be accountable for that. I do agree that yes, prevention, early intervention needs more investment, equal investment, if not more investment than the statutory intervention. And I'll just give you an example. One local authority that I had the pleasure to work with, 100 families in that local authority used to cost that authority £4 million per year, every year. It's because those families were seen as problem families, issue families, antisocial behavior, drug addiction, all sorts of problems. And the local authority has to change their point of view of how to deal with those families rather than dealing with them or addressing them or fixing them when they reach the crisis point. So I do agree with you that it's prevention and early intervention. It's those sure start centres. It's those very early help that our families desperately need that will make a difference, not when they reach the crisis point or when they end up in criminal justice system. I do agree with the data. Yes, I agree with Josh that it's the systems are quite risk averse when it comes to data and data sharing and publishing the information. But I think departments, central or local departments, should be held more accountable to the decisions that they are making, and there should be more scrutiny when it comes to decision making and what happens ultimately. Thank you.
Brilliant. Thank you. Over to you, Richard.
Yeah, thank you. It feels like there was two questions for me there directly. So on the first one, I hope I didn't give the impression that I was advocating for universal services to be completely removed. I do think there is a difficult question to face into there, though, around how targeted can we ever be and what is the right balance. And I think that's something that needs to be worked through. And Maureen, specifically in your point, let's talk afterwards, because I'm not aware that we have done an implementation program with you. But I entirely agree with you. With Maidstone. Okay. Interesting.
So that's where people get angry, because if you put that into the frontline service, it would have been, with advice, I absolutely accept the need for consultants.
Yeah.
But all we ever get is more assistant directors at the end.
And to pick up on your point specifically, I agree, because it is in the frontline services that they have the best understanding of what needs to happen on the ground. I think too often what we see is the disconnect between policy intention process that is designed from the centre and then stands no real world bearing on frontline staff or on the service users that they're trying to deal with. So I agree with your sentiment.
To make a point, frontline staff listen to what the residents are telling them. I think the frustration is when they pass that information up the line, it gets completely ignored. And it tends instead to, well, I've just retired, I've had enough. We've got really good people leaving, and I think that's the big worry for the whole area that we're working in.
Yeah, I think that's right. And I think we have time, if we're very quick, and I'm going to need people to get on board with the 10 seconds for questions, and we'll have some final remarks and people can wrap up, panelists can wrap up. But yes, second row lady there. Oh, there's a mic just coming still.
Hi, sorry. I work for the Justice Reform charity Revolving Doors, so all your points about lived experience are really hitting home. Talk a lot about, the frontline workers see the brunt of this, but what do you think, most experienced people in the frontline services, like you've just said, are leaving. We work with probation, hemorrhaging probation officers, hemorrhaging prison officers, social workers, teachers. People get burned out. So I'd like to hear if you've got any particular ideas or examples of how we can prevent that and address that in the short term, because that's going to be really crucial, in my opinion, to improving public services.
Yeah, preventing burnout, good question. We've got a lady in blue and then a lady at the back. But reminder, 10 seconds max, please.
Oh, I'll try. My name's Grace Duffy from Bridges Outcomes Partnerships. Before that, I was a civil servant for 12 years. And whilst we talked rightly a lot about the local, I'm really concerned that without quite significant change in the centre of government, we are just going to reinforce those silos. So I would just... There's lots to say, but very quickly, what are the prospects for significant structural reform in terms of pooling budgets, longer-term budgets, and really funding more outcomes-focused services, which will help with the frontline services? Stop having rigid service specifications, let professionals do what they need to do, and you can do that through contracting. Sorry, that was more than 10 seconds.
Squeezing, lots in there. And sorry, only time for one more, I'm afraid, but at the back.
Hi, Kieran Gill. I run The Difference, which is a school leadership charity, and I'm an associate fellow at IPPR. We've just written a new paper called Who's Losing Learning, and we heard from the council about prevention in public services. Who's Losing Learning is focused on prevention of mental ill health in young people, escalating to more and more falling out of school through exclusion, non-attendance, or coming to school but struggling to engage through internal truancy or isolation and internal exclusion. And schools as a public service was notably absent from the discussion, from the panel. I'm really interested in what opportunities you see or what you think the challenges are to reform in schools in all of this.
Brilliant. Thanks so much. Well, we'll go down the line, and if panellists would like to wrap up some closing reflections, but Richard, maybe I could start with you.
Yeah, and I think to the question on burnout, just re-emphasising something Josh said earlier, and that we see time and again, but when you look at how frontline practitioners spend their time, more of that has become around managing process and paperwork than spending time with users. And if we are going to transform services and change the way they work, the onus of that can't just sit at the front line. The capacity has to be created. Those processes have to be peeled back to get people back to doing what they do work for. And so I think any solution that looks at how we can help that will only help unlock the overall picture. I'll pause on that one and let others.
Thank you. Can I just address the central government has to start the change if they really mean change. Yes, it's a really pertinent question, and I think devolution. So I am part of one of the local authorities, which is in Greater Manchester. So I can give you. I am the evidence that the devolution is working. So it's not just central government. If the powers are devolved to the doorstep, to the regional level, to the local level, I think we can bring change, because the devolution in Greater Manchester has actually brought us together very, very close to the decision-making tables. So we have more say, we have more of a say when it was just controlled by central government. So I think devolution is the right way forward if we really mean change.
Fantastic. Thanks so much. Josh, I'll come to you, and then Georgia to you, and we'll wrap up from there.
Yeah, so on the example of what we can do to free up frontline practitioners and help them stay, I love this example, and I bore people by talking about it all the time. Georgia and I have already shared our mutual admiration for Buurtzorg, which is the Dutch district nursing service. 15,000 nurses, 50 work in the back office. Every team is self-managed. They are really clear on what the framework and goals around those teams needs to be for them to operate successfully. And one of the core ingredients, one of the key things that they hold each team to account for, and they hold themselves to account on these things, is the productivity rate, which is what percentage of their time is spent with clients. And if it's not between 70 and 80%, the teams start to have some pretty, tough conversations with each other about what's going on. Incredible outcomes, cheaper than comparative public services, and people enjoy it and they stay in the job. Now, we need the same level of courage to ask questions with Dutch directness about how we do our own public services so that we can start to build something equivalent to that. There have been examples of people trying to import Buurtzorg over into the NHS, and the NHS has killed it off every time. It just beats it. The culture just destroys these embryonic great ideas, and it needs more strength, more backing behind it, more of a heat shield for it to stand a chance of showing that a different model can work. And then just on central government, one thing, Rachel Reeves would kill me for saying this, but the Treasury needs to stop doing policy. It shouldn't have any role in policy whatsoever. It's got hundreds of policy officials that shadow box with every government department. It should be out of the business of that entirely. It should set a 3-year budget for every department with a quarterly reforecast. Departments should be responsible for their budgets, and they should reallocate and respend within that envelope. That sorts out devolution within central government, which is a whole issue in its own right, and allows us to actually then properly devolve down into combined authorities. And we should say, and we are doing this, 5 years from now, we want every citizen in the country to be in a combined authority area, set out the menu of services that they should provide, and say, look, if you need to get ready 5 years from now, all of this stuff's going to go to you. So I think that would set out a sort of a real roadmap for devolution and changing culture in central government.
Yeah, absolutely love it. Georgia, over to you for final thoughts.
Thank you. So I think that your point about how demoralised a lot of people are feeling, I think is well made, and everything we've talked about is part of why, you know, these top-down changes that people haven't had a say in, not feeling listened to, unmanageable caseloads, is all contributing to it. So I think that you know, putting public sector workers and those who use services at the heart of redesigning them is part of the solution, because you know, them feeling listened to, a proper feedback loop into decision making is absolutely critical. And I think if you look at countries that are really successful in how they run public services, there is continuous professional development, there is proper supervision, there is real support for our public sector workers. And you know, I absolutely agree with Josh's point about the level of, you know, really feeling empowerment, and that, you know, that if you have an instinct and you know a family, that you can make decisions with that family rather than feeling constrained by the system. So I truly believe if we get public service reform right, it will support people to stay longer in the different parts of the public sector. To the point of schools, I think schools are absolutely critical. They're a universal service. Like, you know, when in my previous role as leader of Cabinet Council and our head of education, cabinet member for children's schools and family is here, we deliberately continued to invest heavily in schools and saw them as a key part of our ambitions for children, you know, universalising trauma-informed practice within schools, making sure that they are linked in deeply with communities. They're a place that parents can engage in, to the intergenerational point. So, and you know, nationally, Labour have been really clear about the importance of increasing the number of teachers and the importance of schools to the opportunity mission. We can have a whole panel just on that. That, I think that is, they're absolutely essential. And to your point about central government, you know, I think that the power of the missions-based approach for transforming how government works is enormous, because none of those missions sit within one department. They require government to work together in a different way, to share outcomes, to think differently about how we spend money together, and they push a different way of doing things. They're deliberately long-term. Keir has said he wants to end sticking pastor politics and have long-term change. So, you know, I think the missions are an opportunity to genuinely transform how we do things, and mission-driven public services have to be part of that. And, you know, this is still, you know, a lot of these questions are still, you know, being worked on, but I think in my role I'm working with colleagues from across government, because this is a shared endeavour, and the power of missions is not just us as government working together, but how we bring in other parts of the public sector, the private sector, local government, and critically communities around that shared purpose. And government has to be different to enable that, and I think that's the journey we're going to go on.
Brilliant. Thanks so much. I think we could have spent 3-4 hours on that, so I'm sorry for those that didn't get questions in, but thank you to everyone here and to the panelists for giving up 75 minutes to talk about this today. I started this panel event with some big challenges, and I come at the end feeling much more optimistic than that problem statement, given the thinking that people are doing and the pragmatism, but also different thinking of approach that we've heard. For IPPR's part, we have lots of public service programs on individual public services and also on public service reform overall. So if those are things that interest you, do keep an eye on our work. There'll be more to come from us in this space too. A final thank you to Newton for being our collaborators today, and this event wouldn't have happened without them. And a last thank to the panelists once more. Thanks everyone, and have a really good rest of your Sunday.